Good afternoon, everyone, and welcome to the first session in our Policy and Practice Provider Exchange series. My name is Kate, and I will be your host for today's session, and I'm part of the Policy and Programs team at Western Sydney Community Forum. So we're starting very promptly on time today, so I'm sure we'll see a few more people filtering in as we go. So I would like to start first by acknowledging the traditional custodians of the many lands that we're meeting on today for our session. We are personally here on Darug land in Parramatta, and I pay my respects to elders on this land and beyond, past, present, and future. And I also acknowledge with respect any Aboriginal friends and colleagues who are here today. So thank you as well extended to everyone who is joining us today. This Policy and Practice Provider Exchange is part of a series of sessions that bring together providers from various regions and areas of focus. These exchanges provide a platform for thought leadership, service system priorities, and social policy dialogue between providers that contribute to the health and well-being of older people. So it's intended to be a space where we can share information, gain cross-sectoral and regional knowledge, and share solutions and innovations. And so really the hope is that we can use these exchanges to ensure that our experiences on the ground are being used to inform policy. So this Policy and Practice Provider Exchange series is brought to you by sector support and development organisations from across New South Wales, including Rhonda Smith at Rouge and Jargon Limited, Lala Nugent at Inner Sydney Voice, Helen Stark at Local Government New South Wales, and us here at Western Sydney Community Forum, including Anita Hanna and myself. So today is the first session, and it is really focused on place-based services supporting older people to age in place. So I think first, it is important to acknowledge the uncertainty of the context that we're working in within aged care reform and transition, given that we have a new Aged Care Act, the commencement of the Support at Home program, the rules, legislation and operational requirements that are coming up, and in particular, the really unknown future transition of the CHSP into support at home. And as we know, the human services industry has a really critical role in supporting older people and communities, particularly being one of the fastest growing cohorts in Australia is older people, and supporting these people to age in place is really a key priority. So today's webinar is spotlighting these local, trusted, place-based organisations which play a key role in the delivery of entry-level in-home aged care. These organisations really ensure that older people can access local supports which fit their needs and preferences, and often using an intersectional approach to support older people to age in place. So the discussion is really there to amplify the voices and experiences of these place-based CHSP providers, bringing together panellists from a range of various organisations to discuss the priorities and challenges facing place-based delivery in the in-home aged care space in both Western Sydney and the broader aged care sector. So before introducing the panellists, I'll just explain a little bit about how today's session will actually run. So the aim of the session is that it's an interactive session. So we would encourage you to contribute to the conversation and ask questions, which you can do at any time by either clicking the raise hand button on your device, where you will join a queue and we will enable and disable your voice function. Or if you prefer, you can just put your questions into the Q&A and we'll read that out on your behalf. Any of the comments and questions will be answered on a first come, first served basis, but we'll do our best to respond to questions. And I think this is also a good opportunity just to note that the session is being recorded. So although we won't see your video, if you are sharing through the voice function, your voice will be recorded. And so if you would prefer to not be recorded in that way, then please feel free to just pop the question in the chat. And you can also toggle to do that anonymously if that's more comfortable for you. So getting into the actual session today, I would really like to introduce our three wonderful panelists. So the first panelist that we have here today is Melissa Stubbings, who is manager at Merana Community Association for the Hawkesbury. So welcome, Melissa. Thank you,
Kate.
All right, and then also joining us is Akech, who is Interim Chief Executive Officer at Western Sydney Migrant Resource Centre. So welcome, Dor.
Good afternoon. You can hear
Good
me?
afternoon. And then finally, we also have Vicki Wilde, who is Executive Officer at Karabi Community and Development Services Incorporated. So
Good afternoon, everyone.
thank you for joining us today, Vicki, and thank you all for being here. All right, so just make sure I've got to enable. So a key aspect of today's discussion is really focusing on some of the changes that we've seen due to the transition and the in-home aged care reforms that are ongoing and have been ongoing for a little while now. So the first question I think will be directed towards you, Melissa. Your organisation really works to support older people every day. So could you maybe start off by telling us a little bit about what you're seeing on the ground?
Didgeridoo, Kate, for the question. So yes, our service has been supporting what we term our senior community. There's a bit of a contention. Some people call them elders, but not every elder is a senior. Sorry, not every senior is an elder. So we call them seniors here, and we've been supporting them under what was before the CHSP was the HAC program. So that's for many years, and we have been seeing a transition. Our biggest fear has been the transition to home care packages where there are not enough Aboriginal service providers in the space, or there are not enough non-Aboriginal service providers willing to partner with Aboriginal service providers to provide the work that we've been doing prior to the clients getting their home care package. So that's been the biggest hurdle for our seniors, which means there's only two things that happen. We lose the client contact, or we continue to work with them even though we're not really supposed to. To be honest with you, we continue under ways of creating our own funding. So Merana has ways of creating funding through offering cultural support to organisations, cultural awareness training, welcome to country, smoking ceremonies. We get a part of the fee goes to Merana, and then we pay contractors to do some of that work. So we create that our own income so we can spend it on things that we see worthwhile. And our seniors are definitely what we see as being worthwhile. So we can keep that. We've also created our own group out of an Ironbark program, which is a falls prevention group, which involves lots of our seniors, but is not connected to CHSP. So we're doing lots of work that we should be funded to do under programs for our seniors, and the agencies that have got the agency to do home care packages should be working with Aboriginal organisations to provide support to our Aboriginal organisations. And funding shouldn't be going to non-Aboriginal organisations from the Aboriginal sector to provide service to Aboriginal organisations, to Aboriginal seniors, if that is understandable. But it is drifting from the sector into non-Aboriginal services, and we saw that happen recently. So what I would like to see is that it's understood that, under CHSP, we are social support individual, as you all know, the different categories. But what does that really mean? That doesn't mean anything really, because our seniors want a wraparound service. They want to come to somewhere and have all of their needs. They want group activities. They want transport. They want all those things from a tried and trusted, that's the biggest thing, trusted community organisation. We've been around for 23 years this year, and our community trusts us. And so then having to ask them to move to a home care package provider that won't negotiate or work with us means we lose that contact and they lose us in, some of their greatest need. So I'll stop there.
Thank you for sharing, Melissa. I mean, it sounds like you're really in a tricky place of trying to manage the needs of the community that you know and that know you, whilst also working with all of that change and where what you actually need isn't available from the system as it is. And I'll just ask, because it's a little bit, I think, similar but different in the sense of the MRC door. So I was just wondering, could you maybe share a little bit about the MRC and what you do as well?
Yeah, thank you, Kate, and good afternoon, everyone. It's an absolute pleasure to represent the Western Sydney Migrant Resource Centre an organisation that has existed for over 4.5 decades, serving migrant and refugee communities across the southwestern Sydney. At the MRC, we work to support people to integrate, to settle, and to thrive and contribute to the communities that they are settling in. Our services ranges from settlement programs to community development, youth support with domestic and family violence, child and family programs, and aged care services. In delivering those programs, we try in all ways to walk alongside individuals and families at every stage of their journey. A key and growing focus, and to contextualize this, a key and growing focus of our work is supporting our older people from culturally and linguistically diverse backgrounds. And that is why today's conversation is really important and central to the views that we will share today. Western Sydney, as we all know, is the most culturally diverse regions in the country. Many older people we work with come from migrant and refugee background. They may speak limited English. They do still maintain cultural or strong cultural traditions to cultures back home, and they rely much so heavily on family and community network. So our responsibility in the programs that we deliver in the aged care services here at the MRC is to support them, to connect them to appropriate services. So we do work with local communities, government services, to be able to work with our community and our members of our community that are aging to live a better life in their communities. We also run flexible respite care as well as center-based respite, and one of the most happiest moment of my stay here and in this organization was attending a seniors week festival event that was run by the MRC, and to hear from our participants about the importance and the trust that has been given to the MRC because of that connections with the local community, that connections with the workers who live and know Western Sydney, and nothing more you can ask from that. So that's the work that we're doing in this space. I look forward to contributing and to sharing my thoughts around the play space and why it is important. And as you can see, it becomes very clear delivering services in a place-based approach is central to the aging population, and it's also central to the reforms that we're experiencing today, because it recognizes that when people are supported in their local communities, they find peace. And I'll talk about 3 things when the next questions come.
Thank you. Thanks for sharing, Dor. It sounds like, similarly to Melissa, that really important thing of trust and having that trust with the community. And Vicki, I think Karabi as well is similar to the MRC in the sense that it is a generalist service which provides those wraparound supports and services to people across the lifespan. And I know that you work from family support to general community development, disability services, and CHSP services to provide support to older people. Do you think that there is a role for these generalist services in the new aged care space? And what do you see as some of the benefits to communities from that kind of model of service?
I think, there's 2 sides to it. Does the government have space for us? That's the age-old question. But it is definitely needed at a service delivery level. as most organisations, we are face-to-face service providers. We don't just provide, you know, a shopping trip or some social support. We actually build relationships and become part of people's lives. Without that, it's disconnected, and it's service provision, and it's not social connection. It's not building trust and knowledge and dignity, which is what we want our seniors to have, because they've had a lifetime of building that in their own communities. I want to give you an example of how it works, because I think we all know what we see as good service delivery for our seniors. We had a lady that was dragged to us by a neighbour. She had recently lost her husband. She had been a stay-at-home mum. She's a grandmother, but her family's moved away. She was socially isolated, getting very depressed, was having trouble going out and getting shopping, didn't have some mobility, and she was brought along to our knitting group. And from that, she built social connection. She was able to access my aged care, and we helped her through that process. So she had someone to help her and hold her hand through the process, which is often confronting for our seniors, because it's, you know, do this, do that, what, you know, give me this information, thank you, hang up. It's not what our seniors need to have well-being, and definitely not what they need to have dignity. And so our lovely lady now, she doesn't come to knitting because it's not her forte, but she has built relationships with the ladies who do go. She is having help with her shopping. She's having help with some travel. She's helping herself, and she is no longer depressed. And they're her words, not ours. And that's what we want to see our seniors do over time. I see particularly CHSP services in small organisations, in our place-based, as it should be the model of choice, because we do build the dignity, respect, connection. If we don't see someone for a couple of days, we give them a call. If that service model was thrown across all of the 8 areas of the program now, it may be a different story, but it's not. We're hearing stories from a lot of our clients who may or are eligible for aged care packages, who just don't want to move. They're quite scared of it. And I think if we had place-based provision of that service to start with and to continue it, really, it begs the question of how many people would go for an aged care package if they had their needs met at a local level.
Thank you, Vicki. So I think that's such a wonderful story, and that it really exemplifies how you have that sort of soft entry point that then reaches so much further and is so meaningful in these people's lives beyond just having someone help them with their shopping. You know, it just really goes across everything, doesn't it? Just a reminder, if anything for the audience comes up and you have any questions or anything, feel free to pop them in the chat as we move along. We're happy to take questions as we go, as well as towards the second half. And I think that brings us really nicely back to you, Melissa, in the sense of, you know, as an Aboriginal community organisation specifically, what have you found in terms of the place-based service delivery? What is the most important to the older people and the elders that you work with at Merana?
I think the consistency of contact, the consistency of the staffing. You know, we don't have a high turnover of staff like some of the bigger agencies that are covering multiple places. This is one of the burning questions about our service. Do we go bigger, or do we stay where we are and just do the work that we do with, you know, I believe we provide a quality, as in a quality of service that you don't get sometimes, no offense, but in the bigger services where there's multiple sites, there's multiple changes in staff, there's, you know, inconsistencies in some ways. Yes, of course, there's always disadvantages to a small organisation, but it is an organisation based where those people are from. We know the people they are talking about, the other agencies, like it, because we're such a small community here in the Hawkesbury, really, but our reach is across Western Sydney in some ways. We have clients that are in different, not just in the Hawkesbury. But because we have good relationships as a small organisation in our community, we're able to then refer, we're able to make good connections. We know the doctors, we know the receptionists. Like there's all that kind of that you don't get if you're in a bigger organisation, to be honest, or not in the place that the service is. If the service is needed, let's say, I don't know, Springwood, but the service comes from Parramatta, you don't get that understanding necessarily. So, it's what's happening in our community for our seniors is happening for us too. Most of us live in our community as well, live locally. So it's happening for us, when there's floods or there's fires or there's things that are happening. Sometimes, to put the other spin on it, the media will exaggerate things, but we know what's actually happening for our people because we're right here. So nobody's getting overwhelmed or overexcited by the media reports because we know what's actually really happening. So we're able to engage with our seniors in a way that says, it's okay, it's okay. What the media is saying is a little bit of hype because it sounds good about the flood but you're safe, because we're here, we're right here, we're right alongside them. Our office isn't flash, but most people who come here say it feels like coming home. It's a small place that we've built into a really nice place of belonging. All our community that come here, they are treated as if they belong. Everybody belongs. We are flexible in our delivery in terms of who comes into those programs. So not just talking about our CHSP, because as I said before, we go beyond that. And so we have to take people, obviously they're on my aged care into CHSP, but they then become part of our Merana family, if you like. They're not just a CHSP client. We actually rarely use that term within the organisation. We call them our seniors, our seniors group or our seniors activity and that group gets invited to our family fun days to integrate with the rest of community or to our NAIDOC ball, or they have their own tent at our NAIDOC concert. It's part of all of what Merana does. It's not just a separate section. Everything works together, and it's a whole of community response. I hope that answers it. So I think place-based, you really have to be involved in your community. The bigger organisations, again, no offence, but I don't think you offer that. I don't think they offer that ability to be walking alongside the client the way that we do.
And I can really hear as you're talking coming through how proud you are and how much you care about your community. And I think that is part of it. It's your community, so you care.
100%. There's a passion. There's these are the people that I've looked up to in some ways too. Like they're people that I've worked alongside now that are seniors or family members of people I've worked alongside of, or and I hope that when that's my turn, in some of the categories, because it's over 50 for Aboriginal people, I would fit anyway, so I'm already there. But I hope that when it's my turn, that it's still there for me to be a part of and for me to have that experience and, to just the joy that they get out of it. They're getting together and being a part of our community, and that's what it's all about for me. From my perspective as a culture, from who I am, it's about connecting people. It's about keeping people together, and giving them a space where they can truly shine and be happy.
Yeah, thank you for sharing.
Yep.
And I think moving across to you, Dor, I'm curious to know, delivering place-based services in a way that meets the needs of a very diverse, culturally and linguistically diverse population. Sorry, that was redundant. What are some of your key considerations in ensuring that you are meeting those needs, and how do the specific communities that you work with shape the way that your services are designed and delivered?
Yeah, and underscore that working with cultural and linguistically diverse members of our community is one of the most critical areas of work. It is tender, it is needed to be carefully curated. This is because for many of these members of our community who are aging, aging comes with added complexity. You know, they already have language barriers, they face social isolation, they have or do navigate unfamiliar service systems, and sometimes mistrust of some of their formal institutions that we see. For many, also carry experiences of displacement, trauma, and loss, and you know, hopelessness. So this is why it is quite an absolute importance and essential for organization like ours to then work with them deeply by embedding our delivery in the community. And to say that being embedded is not just about local presence, it is about the legitimacy and the trust that people gives you because of the work that you have done, the understanding of their cultural background, where they're coming from. And so our strength as an MRC lies in the relationships that we build with our cohorts. We are trusted because we reflect the communities that we serve. I look like me and someone looks like the client down the road. You know, our staff, our partnerships, our presence in community is just visible, and we speak to that language, to that culture, to that needs, and engage with community leaders who are often the first point of contact, albeit the elders in those communities or faith group that have meaningful connections to our participants. So when seniors and do interact with us, we make them feel safe, feel heard, feel culturally attuned to them, and as they engage. And so that improves their well-being, that improves their connections to the community that they are in, not just as individuals, but also their families and communities that they come from, because there is a whole wealth of importance placed on elderly people. And so, in delivering these services, what we do consider as the MRC in shaping how we work with older Australian are a couple of things. I'll just only touch on three or four things. Firstly, we prioritize cultural responsiveness and co-design. We do not assume that we know what the community's needs are. We ask, we listen, we work around things, designing services together with them. Second, we prioritize accessibility, and it becomes a central component of our delivery. And it is not about just physical accessibility. It is about the language support provided, the practical considerations like how do we organize transport for them? How do we ensure that the services that we deliver are affordable in terms of their cost share? How do we take into consideration digital inclusion? And a perfect example is we ran a digital inclusion here in the organization and offer it to people to be able to learn how to operate government services that are in the digital space. Services must meet people, not people moving. Services must meet people where they are and not where we expect them to be. That's important to us. A third component of our consideration is around the collaborative approach. We take a partnership-driven approach. Western Sydney MRC do tapped into the networks that we provide, and certainly the Western Sydney as a region is reached in community leadership. It's reached in grassroots networks. It's reached in what people can bring to the table in supporting our lovely community. We collaborate closely with those communities community association, local community organization, religious institutions, and leaders that are serving and knows a lot about that. And the fourth thing to emphasize here is around flexibility and adaptability. The communities we served in do come from a variety of background. They are dynamic. Our service delivery must respond to such a diversity. And also not just aesthetic diversity, it is an evolving diversity, and we must evolve alongside with the communities that we service. The reality is Western Sydney is one of the most culturally diverse regions in our country. And as that diversity is shaped, we must make everything correspond to that evolving diversity. There is no one size fits all in any of our regions. Their needs, their expectations, their priorities, their experiences of each community are central to how we deliver. We make those considerations for front and center in our delivery. For some, aged care services may be quite unfamiliar. They have not utilized such services because there's a reliance on cultural values of around aging. My mom would not agree to be put in an aged care facility. So then how do we work with those in alleviating family responsibilities, in working alongside with people to be able to understand that it is normal to go into an aged care facility, be able to work through if that is not comfortable, what's the alternative, cultural and safe alternative for people. And so that stigma that is attached to aging can be then supported through the lenses of cultural advice. So at Western Sydney, we respond to many of these things that are not just about inclusion, but culturally informed and where needed, culturally specific to each cohort. And as such, we elevate the voices of our community group in decision making, in program design, and ensuring that lived experience guides the work that we do. At the end of the day, the goal is simple but powerful: to ensure that no one is left behind, that every older person, regardless of cultural background, language, difficulty, migration journey, or whatever they may be, can age with dignity, with connection, with support in their local areas. Because we understand we belong to a community and community belongs to us. I think I'll leave it there at the moment.
Beautiful. Thank you, Dor. And it sounds like that is a really critical piece that you were talking about, is not just, having the services, but supporting people who may have barriers to even getting to the door of accessing those services, which otherwise, if you weren't really part of the community and open to listening and hearing, you may not even know that those people aren't accessing the services because you're not even aware of it. So I think that was a really important point that you raised. And there is just a comment here that I just want to read out, which is not a question, but it was in regards to what you were saying before, Melissa, and it was saying that you described the Hawkesbury perfectly and that it is truly a lovely community to work in. And so this is Catherine from RCSI. She's saying that they too go above and beyond with their CHSP clients because sometimes that is the only connection that they have. And so she's just given an example of a coordinator who was at the hospital last week supporting and advocating for one of their clients. And she's saying that they also organised care for her pet when the client went to hospital because she was so worried about leaving her dog. And so Catherine's just saying that type of connection and support isn't part of the CHSP agreement, but she's saying, if they're not doing it, who is doing it? And it's more than just being a client, but because she's a person. So I just thought I'd share that because I thought that was a lovely comment that really does exemplify what you were speaking to, Melissa.
Yes, sure does. I mean, there's lots of examples of that from all our local organisations, I think, of where we've gone above and beyond, whether it be for pets or whether it be looking at ways, we have some clients who since COVID still won't leave their homes. So whether it's, the way that we manage that and going around and doing that, I think if you're, I hate to keep saying it, but if you're in those big organizations where your policies and your procedures are so strict that you can't maneuver out of those and you can't be flexible, then I think that's the downside. And I know that in some circles you'd hear the comments about, oh, the safety, if you go outside of that, you're safe. But I think we're mature people mostly that are working in this space. We know how to be flexible with safety in mind, with consideration for each of our clients' needs. I think sometimes the policies and procedures of the governing bodies or the funding bodies actually treat us like children. Like we don't know how to actually work in a space that keeps our clients safe, that we need them to be telling us how to do everything. And it doesn't give us the capacity to use our own knowledge. And I think that's really important. That's particularly for us as an Aboriginal organisation. We need to be able to have the space to use our knowledge, our experience, our maturity in making decisions. Like I've been in this space community sector for, nearly 30 years. I think I've learnt a thing or two. And so that's not respected. Everybody's treated the same, and we're treated, I feel, like children sometimes by the policies and procedures that are handed down and the way that we're told how to do things. Yeah. But there are lots of examples, and I'm really grateful that, the place-based services are going out of their way to help seniors across the board.
And I think that really segues nicely into my next question for you, Vicki, which is really about what do you think should be front of mind for organisations who are focused on delivering those in-home aged care services while in a place?
Can I start by saying I have to agree with Melissa and Joel. We are not inside a box that needs to be told how to get out of the box. We can provide holistic approaches to our service delivery, and in that it's about the organisation itself putting some priorities forward. Things like community connection should be the core business. It's not the side benefit that comes from dealing with people. That we should, always maintain equity and access for all of the people that walk through our door. And if we can't provide the service for them, we have the ability to find a service partner that can do it, that is more suited to them, not just, oh, sorry, you don't fit into my numbers this week, go and find somewhere else. We have the ability to look for preventative measures for some of the conditions that may impact our seniors, but we can also look at early intervention. Like the lady I mentioned before, she was heading down the depression pathway, and we all know that leads to poor well-being and health outcomes. So we have the ability to identify that before it becomes a problem. By collaborating with other specialist services and generalist services, we can actually make sure that, we may not sit in that space. We may connect in a local area, but we also have the ability to say, okay, you're moving to go and live near your daughter. Here are services that you can go in contact with. And we can even make that introduction. We can sit by them while they walk that path in a different direction. And we have the ability to make the decisions outside. Like Melissa was saying before, we can fundraise and value add to what we're giving to our seniors that don't sit under a funding guideline that, makes you jump hoops to be able to provide the service to our seniors. And seniors who can tell us what they want. They can tell us how they want it delivered. They can say when they wanted it, where they want it. And we forget about that people have the dignity to be respected in their decision making. If you look at a funded service that tells you can do X, Y, and Z, and you can't step outside of it, like Melissa was saying, with bigger services, they are constrained by all those different dimensions around policy, procedure, management levels, staffing levels. Our staff build relationships, and they do stage, we don't have a lot of staff turnover either. So you need to have your board on board. They need to have a really clear understanding of the governance of providing a service that may sit outside the box, and that you have the ability to have people that work alongside all of those factors. They have to be flexible in their own natures. They have to be connected to the community themselves, and they have to really take into consideration the needs of the client, not the needs of the service funding agreement. I think it's a very unique place that we can be in, and we actually have the ability to provide more and more if we have the opportunity. So I think I'll leave it at that too.
Wonderful. Thank you, Vicki. And I think there's another question that's come through which really connects to something that both you and Melissa touched on, which is talking about how challenging it is to find workers to provide that really high quality in-home aged care services. And so this question is asking if you found that taking a place-based approach has influenced your workforce retention at all.
I think it has, to a degree that people don't come to the place-based organisations without a specific focus anyway. They want to work for a small organisation. They want to be connected. They want the flexibility of working with small. We have the ability to work with them, not just direct them. If they have, family obligations, we can work around it. We make our workers part of our community, as well as our clients. It also is about values. You need to employ staff that have the same values as your organisation, that want to connect for the same reasons that you are running the program to start with. It doesn't help if you have someone who just wants to come in, earn a little bit of money and then walks away, because they will have no buy-in for the outcomes of our clients. And we're not a good fit for them then. I don't know if Melissa wants to add to that.
I would say I agree. Definitely the criteria for working here is that our staff are all Aboriginal. And so with that comes an obligation to our community. So that is truly tried and tested sometimes in a lot of the work that we do, but it may be an obligation, but it's also a privilege to provide that for people, regardless of whether they've given back to community or not. They are our community. Their contribution at whatever level builds our community into what it is today. So I would just say that along what Vicki was saying is that our staff do get some flexibility. They get some opportunity to go above and beyond some of the work if they want to. And with that brings to them, I think, a sense of reward and a sense of what it's all about for us. It comes back to what our culture really means to us at the heart of it.
Thank you both. I think that's really insightful when you can, if you're part of the community, the workers are part of the community, there's benefits for the workers and older people in that community. Absolutely. And Dor, there's a question that's come through for you here, which is asking about, have you found that the population of people accessing your services has changed in recent years?
Yeah, certainly in the context of the southwestern Sydney, particularly area like Liverpool, there has been a significant change in the last 10 years, and probably in the next 10 years it will look again different as it continues to evolve rapidly. Just firstly, the changes that we see is that there is a growing increase in the number of people that are aging. I think through the census or some research that was done a few years back puts it at about 74% increase by 2030 in relations to the number of people. But what makes it challenging is the growth in the diversity of that aging population. A large and increasing portion of people from core background in these regions are really diverse. We've seen primarily it started with the Asian cohort, the Southeast Asian cohorts. Then we are starting to see the Middle Eastern cohort with its diversity. So you've got the Iraqis, the Lebanese, the Assyrians, and then you also have the African cohorts emerging of recent. So you've got the Congolese, the South Sudanese mainly now in this area. So you can see how that is shifting in terms of what considerations are. Now, what it does is that it brings a little bit of a challenge, because these are communities that hold different perspective around what the aged care services look like. There is a continuous, let's say, approach around family-based care, which really is a different type of care that is required by these communities. There is also a requirement for community connections or community identity, kind of cultural identity dilution. And that is something that is really important we're seeing. At the same time, there is still, or there's an increase in the challenges I mentioned around English, around literacy, around the system of the HKS and how complex it is, but around the actual health need of this population, which is challenging. You start to see chronic health issues that the aging population bring, and in some cases it is what makes it challenging as well in this particular area. One other thing I'd like to point out in relations to the aging is that there is that intergenerational gaps that have started to affect how people care. What should be the consideration of kids that are growing up in Australia vis-a-vis older members of the core community who grew up in their home cultures? So we'll start to see those patterns and the challenges that are related to that. Can I add a little bit about the question earlier around the staffing? I think many people, the cost of living and COVID has kind of opened our eyes to a different world of how do we deliver, or how do we work with work-life balance consideration. So people want to work closer to home. People want to work flexible hours so that they can attend to family. And people do want to align with something that is aligning with their values, organizations that align with their values. So those have definitely made it a lot easier. Like when I talked earlier about the staff members that we have here, the passion that someone puts into that, it's incredible. To some time, the limited resources that we have, people go above and beyond because of that passion, because of that connection, because they look at the people that they're servicing like they're members of the community. They connect to them. It's beyond a job, and certainly has made it a lot easier for people to work in this sector.
Yeah, I think that's something I've heard all three of you say today, is about that point of going above and beyond for the people that you're supporting. There's another question which I think is directed pretty generally to all three of you, which is talking about using the term place-based approaches and recognizing that while some services might be delivered in place, not all are place-based in their design. So this question is asking, what have you done to ensure that your approach is genuinely being shaped by the communities you serve? And in what ways are you working within the local service systems to shape your care around place rather than just delivering services within a location?
Happy to go, because I spoke earlier about what we do at the MRC, which is around prioritizing cultural responsiveness and co-designing our planning, in our ideation processes. This is important because, as a person who lived experience, I'm an ambassador of lived experience in knowledge, and that's because I lived it, and I am able to have vivid, perspective around what needs to happen. So I value genuine co-design where, for example, when we were organizing the Seniors Festival Week recently, we had members of our seniors program, part of their planning as to what do they like to see, what do they want us to deliver, and for them to say, okay, we want these, we want these, we want to do this, we want to have a dance, like that's something that we don't usually think about. Okay, if we were to do, oh, we will straight away start to think about risk. We start to think about what's budget that we have. We start to think about who is going to be available on the day in my staffing group. We start to think about the venues that we go to. But for them, it is the experience that they want. And that's what we prioritize in that. So having the co-design, having the responsiveness as a central element in how you plan services is really important. Some of the you'd be surprised, some of the participants would want something, but then they feel like they don't have the power to ask for it. And I encourage my staff, let the staff ask. If it is something out of our control, at least they have added. Could be considered in another way in the future. So that is something that is important. How do we centralize? How do we not centralize? How do we ensure the cultural responsiveness and co-design are central to our planning and delivery of aged care services is really important. It has to come from heart.
Thank you, Joel. So the co-design piece is really a critical one for you. Vicki, Melissa, is there anything you'd like to add?
I think, place-based is talking about the space we're in. But if we look at the model that you use to work with your seniors, then place-based can be transposed anywhere. It's not confined by a building or a suburb or an LGA. It is a mindset, and it's a cultural, internal cultural avenue that you use to approach everything you do. And that can be transposed if you don't have a space to work from, if you don't have a building to work from. I think Melissa spoke a few times about the larger organisations, and you see in some of those levels of service delivery, some of that mindset is there, but usually at the ground, that mindset needs to be moved up the leadership pyramid to the top to give it a place-based approach. I think, as Dora and Melissa have said, we've been in our spaces for a long time and have built that model from experience, not just from a policy and procedure perspective. And that co-design and that working with the cultural practices of the local community, they set the model for place-based, not the organisation.
I think the whole thing about co-design can sometimes be a little bit, it depends on your, I can't think of the word, but your interpretation of what that means. So, for some people, it means sitting down and having this one conversation about what the design's going to look like. What happens at our organisation is we hear people talking about what they like to see happen or where they'd like, their lives to be headed, what they want to have in their life. Or, for instance, it wasn't CHSP directive, but it was our CHSP cohort who attended what we call Ironbark. It was an Ironbark program funded by Health. We had that for 3 months, over 2 terms, and we then picked it up as a program under Merana because what we heard and what we saw from our clients coming to that program was that they wanted it to stay. It's a program for seniors, helping them learn about how not to fall over, falls prevention. So we Health fund us for an exercise physiologist. We fund the food, the staff member to run it, all of that stuff, because we heard from our community. So as long as people aren't thinking, and I just don't know if, no offense to the person who wrote the question, but sometimes it feels like people are saying, using that word co-design, they have an idea that you have to sit all the time and you have to work every model out with your community. We are the community as well. We're hearing what they say. We're implementing what we hear. So co-design, so long as we've got the right understanding of what that means, that's what I think anyway. I just think it's about we are with our community walking every day. So we hear when they say they wanted that group to stay, or just by them attending, we knew they wanted to stay. And they're still coming, and it's increasing the numbers in that group. So that's how we action co-design as I see it. It's actioned in a way that's very practical. It doesn't require our community being overtaxed about things that they don't really, things like organizing things, how funding works, acquittals. They don't need to, that's too much, not to say above their pay, well, it is above their pay grade because they're not getting paid. That's kind of what we do over here. And then we work with what they tell us on the go, if you like, as we're talking to them, as our drivers come back and say, oh, somebody said this, they said this would be a good idea. And we go, oh, how would we look at that? And what would that look like? Doesn't mean we then take that idea and then survey all of our cohort. So I just want to just say that might not look like sometimes the way we're doing things is what some people might think is co-design. But I think you have to, again, like everything we've said today, be flexible in your thinking, be flexible in that. And we wouldn't have a community coming to our centre like they do in all ways, not just seniors. All our community events are very well attended. We wouldn't have that if we weren't listening to our community. So co-design to me means listening to community. I suppose that's a long way to getting to that.
And I think that's all we have time for today in for our questions. I think that went really, really quickly, but I just want to say a big thank you again to all 3 of you for being here today. So thank you, Melissa, Vicki, and Dor, for joining us and for sharing your experiences with everyone. So thank you.
Thank you.
Did you go? Thank you.
Thank you. So I think today's session really did highlight that critical role of place-based services in ensuring that we are able to effectively provide that person-centered, community-led service to support our older people. And I think that it's particularly important. I could hear that coming through when Melissa was speaking about the Hawkesbury region and in an area with such diversity like Western Sydney. It is so important that older people are able to access the care which meets their needs and is accessible in, more than just physical ways to meet those needs and be where they're at. So just in the last 2 minutes, I just want to put out a reminder that the sector support and development organisations like Western Sydney Community Forum have a range of services to support CHSP providers, such as training, networking, newsletters, tools, information, and resources, as well as assisting to engage with the department and at the policy level. And if you haven't already registered, the next 3 sessions in this policy and practice provider exchange will explore a few different topics, including CHSP and social connection, rural councils delivering CHSP services, and culturally inclusive care. So the next session, which is going to be hosted by Inner Sydney Voice, is on protecting entry-level care, and it's about the future of CHSP and social connection. And that will actually be held in 2 weeks on Wednesday, the 29th of April at 2 p.m. So the final thing is really please don't hesitate to contact us for any further questions or support. So you can send us an email directly at info@wscf.org.au. I know there were a few questions that we ran out of time for today, so we can follow those up there as well. So thank you again, everyone, for joining us today. We really do appreciate your time and all of your contributions to this really important discussion. That does, however, conclude our webinar for today. So thank you and goodbye for now.